afternoon. Greetings, everybody. I wanted to come and share something with everyone because now is a very important time of year. Earlier today, my husband and I were sitting down and going through the options through his employer for our health insurance benefits and health savings account and flexible spending account and dependent care account and vision plan, dental plan, etc. And what I realized having a private practice is that a lot of people really don't understand how their benefits work and how you could really take advantage of them. So I wanted to share a couple of tips. So if you've joined, let me know you're here. Like, comment, share. If you're watching a replay, put hashtag replay so that I know you're here. But this is some important information because you could really save a lot of money on things that you're already using that you need for your general health, and especially if you have particular health problems. So in particular, I wanted to know how many people might not realize that, you know, the Peloton cult, where everybody wants this fancy Peloton, whether it's the bike or the tread or whatever fitness equipment that you have, that a lot of times there's a lot of conditions where that could be considered a medical necessity. If your healthcare provider has recommended that you include a regular exercise regimen as part of the treatment of your condition, then that could actually be an eligible expense for your flexible spending account and perhaps your health savings account. You could clarify with your employer how the plan works or with your accountant. But actually, if some pretty common diagnoses, it actually may be a benefit. So now would be the time to think about that, because you would have to select that as an option to get the tax-free money taken out of your check, so that you could get, basically, if you were getting, just using the Peloton as an example, you could get it for, let's say, 25% off when you consider that that income that you set aside for that health care expenditure would not be taxed. You wouldn't be paying income tax on it. So guess the common conditions. If you pull up one of those BMI calculators and you put in your height, put in your weight, and it says your BMI is over 30, guess what? That means you have the medical diagnosis of obesity. And that actually could be an eligible expense for you. If you have hypertension, having a regular exercise program would definitely be part of what I recommend as part of your treatment plan. So that would be potentially an eligible expense. And even diabetes or prediabetes, these are valid medical conditions that are super common, unfortunately, and which could mean that your fitness equipment, just using the Peloton as an example, because people seem to love it. I mean, they're on it, they're sharing, they have whole communities built around this particular type of exercise equipment, but it actually might be a qualified medical expense. What you would need to do that is to understand that you do need to have a medical condition like obesity, like diabetes or prediabetes, like hypertension. You can't use it for general health maintenance. Of course, all adults are supposed to be getting 150 minutes of moderate intensity physical activity per week. That means 30 minutes, 5 days a week. Most of us aren't getting that, but you definitely need to get it once you have a condition that can be helped with exercise. Now, what's usually required depends on how your how your benefit is set up, how you access it, how you use it. With many of them, you will have to make the purchase and then submit that for reimbursement. And with that submission, you usually would need a letter of medical necessity. And that's something that would need to come from your healthcare professional, your physician, nurse practitioner, PA, maybe even like a dietitian potentially. I'm not 100% clear on the credentials of the person who would be writing the letter of medical necessity. But what I would suggest is that you don't go in there having already bought the Peloton and shove the thing in front of your doctor and say, here, you need to approve this for me. You should have that conversation in advance. And I can tell you as a physician, if you make it as easy as possible for me, I love when people exercise. I'm all for it. I don't like paperwork though. So if you made it as easy as possible for your doctor, just outlining what needs to be in the letter. And if it's even better if there's like a form letter, I'm going to look for one, because now that I'm putting it out there, I'm sure someone's going to ask me. But the letter has to have specific information, like the diagnosis with an ICD-10 code. So for instance, for obesity, the ICD-10 code for obesity, general obesity, is E66.9. Obesity due to excess calories, E66.09. Unfortunately, this is how we communicate to insurance companies. We can't just say what the problem is. The problem has to have like a specific diagnosis code associated with it. So for hypertension, that's generally I-10, or there might be some more specific codes if you have problems related to hypertension, like your heart is enlarged because you've had hypertension for a long time. It might be a slightly different code. Or diabetes, those generally might say something like E11 point something if you have diabetes. So these are codes, diagnosis codes, that would need to be in this letter of medical necessity. You would have to have your healthcare pro be specific about what treatment they were recommending, whether they were recommending exercise program with a treadmill or stationary bike or a health club membership to use 30 minutes, 5 days a week, et cetera, et cetera. And then the treatment time period. Now, obviously, from my perspective, the treatment time period is indefinitely. Like, yes, you should exercise regularly for the rest of your life, but usually it defaults to a year. And then might need to be recertified if it's an ongoing expenditure, like a gym membership, or like, for instance, the membership, like the monthly membership that you would need to sign up for with the Peloton. But a lot of people have no idea. And I can tell you, we had kind of a discussion in my one of my favorite physicians groups, where a lot of the physicians were like, oh, that's not legitimate, or that seemed like, you know, a real reach there. I don't want to be involved in any shady stuff, which of course nobody wants to be involved in anything shady. But we know that obesity, diabetes, and hypertension are medical problems for which exercise is or should be a part of the treatment program. So discuss it. Have that conversation with your doctor in advance. It's super helpful. Please, it would help. I love to get a form where it's already laid out, where I can just like check yes, 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 write in any clarifying points, sign it, and we're done. If it's like that, that's perfect. And then you can take advantage of a little bit of advanced planning, where you're going to set money aside for this healthcare purchase that you need, and you can use that. And it's similar with a lot of other things too, like many commercial health insurance plans don't cover the blood pressure costs. But of course, you need to have that so that you can monitor your blood pressure at home between visits, if you're doing telehealth visits. And those are things that are eligible medical expenses that you should be able to get tax-free, or with money that you didn't have to pay income tax on, to be able to purchase your blood pressure meter, thermometer, other types of medical equipment. Even a scale could be part of that obesity management program. The Peloton, the treadmill, the gym membership, a scale. Those are things that are, you know, eligible expenses if your doctor agrees, and if you have a letter of medical necessity that gets submitted in whatever way that your plan requires. And so it's just something to think about, because we were doing our benefits today and trying to figure out, okay, we've got one less person in the house. So do we, you know, how much do we think our expenditures are going to be? We choose to use a high deductible plan with a health savings account. And being married to a financial planner, when he figured out that you can, you know, invest the health savings account funds, and, you know, being married to a doctor is pretty handy for him, where most of the stuff, like most of our health stuff, like honestly, I could take care of, where we're not really spending a lot on healthcare, where we like to have that available if we need it. So we have what we need in case we had a huge expense. Like last year, my son ended up needing a bone transplant, believe it or not, and had 2 surgeries in his knee. So we actually reached our out-of-pocket maximum last year, but we still saved money on our health insurance by choosing a high deductible plan because we paid less in premium than all of that, where it still was a savings for us to have to reach into the savings account and do it. So understand your benefits, understand that you might be paying for some things now with money that you already paid income tax on, that you didn't have to pay income tax on that money. You just have to plan ahead a lot of times and put the money to the side, get your paperwork in order, have the conversation with your healthcare professional about the letter of medical necessity that's needed. So yeah, that's just a little tip. Oh, another one before I go, because one of my favorite things that I use like practically every day, maybe not every single day, is a water flosser. But many people have mild or severe forms of gum disease, and the Waterpik company actually has a letter of medical necessity that you can print right off of their website. I actually did. I printed it out. You can get it signed by, if your doctor felt comfortable enough to look in your mouth like, yeah, you could use this. This is definitely a medical condition that you have, or even your dentist could sign off on it, and you could submit that to your FSA plan so that you can have excellent oral hygiene and health and beauty, of course, because, you know, nothing like a beautiful smile that is well maintained with a Waterpik. So little things like that. It could be big things. It could be little things. So that's all I have. I wanted to invite anybody who's interested in learning more about our direct primary care services and signing up for the waiting list that we are going to be opening up going into the new year. Not exactly sure if it'll be January 1st, but going into the new year, planning for a different way of delivering care that is not transactional. Not like, okay, you have a visit, you pay, and then I provide medical service, but more like, you with us, you're not with us, that type of thing. So, all right, that's all I have.